Alright, my name is Hannah Wilson, and for my PowerPoint presentation, I chose to talk about alien hand syndrome. This is something that I had never heard of, and the name itself was just really intriguing to me. Like, what does it mean for a hand to be alien? Like, that's just weird. Okay. So first, what exactly is it? Well, in shortened terms, it's when the hand is involuntarily moving, and it's often the left hand that this happens to for some reason. Although it can be the right hand, and sometimes it's even the leg and not a hand at all. An example of this is a 77-year-old woman and her experience after having a spine surgery in which her anticoagulation was briefly stopped. After her surgery, she started noticing that her left hand was like grabbing for things, reaching for things whenever her mind hadn't told it to. And that's the thing about alien hand syndrome, is that it's not like a spastic hand motion. It's more like you consciously think, oh, I'm gonna go grab this apple off the table, or I'm gonna pick up this pen. It's the same thing, but your mind isn't telling you to do it. You're just picking something up for some reason. And so that can be really scary to seem like your arm is acting completely of its own accord. And sometimes patients even said that they were able to try and stop the hand from moving with their other hand, which is working, which just shows how equal the two hands are in their functions. Just one is acting of its own accord, seemingly. Alien hand syndrome can also be a presentation of cardioembolic stroke. The symptoms, as I discussed previously, are a hand moving without the body telling it to move. Again, not spastic motions, actually very coordinated hand motions, which makes this an even weirder phenomenon. And it can be accompanied by aphasia, which aphasia is when you are unable to understand or express words or anything. Weakness, sensory loss, and agnosia, which agnosia is the inability to understand sensations or recognize things. Just pretty much an inability to understand kind of what's going on. And those, like I said, those are other things that happen whenever someone is suffering from alien hand syndrome. There are 3 variants of alien hand syndrome. The first is frontal, the second is callosal, and the third is posterior. And why does this happen? There's a lot of reasons from what I've read as to why this happens, but the main ones are lesions on the brain in the posterior parietal cortex, the corpus callosum, supplementary motor area, and the anterior cingulate cortex. It often occurs after a stroke or after major neurosurgical procedures, particularly when the corpus callosum is involved. Just like the 77-year-old woman in the example started experiencing these things after a surgery. A bit of history is it was identified in 1908 by Kurt Goldstein, and since it was identified, there's only been 40 to 50 cases since its discovery. That's in 1908, that's over 100 years. There's only been 40 to 50 incidences of this. And there are even also possible misdiagnosis, meaning that a hand moving of its own accord was actually a symptom of another illness and not actually of the alien hand syndrome, meaning that there could be even less of these cases than we think, other than the 40 to 50, there could be even less. And there's also infrequent research and no hard data, which is because of the fact that it is so rare. People just don't feel the need to research about it since so few people in society actually struggle from this. Like, what reason is there to research if there's not that many people suffering? As for treatment, there are no recommended or approved therapies for an alien hand syndrome, and treatment is mostly anecdotal. This means that someone who is suffering from this is pretty much going to just be like a case study. There's not really anything that has been found that treats this. But there was a 13-year-old girl who had alien hand syndrome who experienced a 70% reduction per minute of involuntary hand movements after she was given clonazepam and botulinum. Cognitive therapy has also been effective in some cases, but again, nothing is really proven just because of how rare this disease is. But basically, it kind of comes down to people needing to learning how to cope and manage with this, because like I said, it's just involuntary hand movements. So depending on how drastic or extreme the hand movements are, it really isn't something that will affect someone's daily life in an extreme way. it's mostly just something that is going to be kind of annoying or even kind of alarming at first whenever your hand just picks something up. Or I suppose it could be dangerous if someone started stealing or hurting others around them, but from what my research has shown, it's usually just someone grabbing something, touching their other arm strangely, just stuff like that. It's pretty much what really mostly happens with this. So in summary, this condition is not very well researched, so conclusions are hard to come to. It's a very rare condition, and those suffering can live a normal life, as I was talking about earlier. A few words, though, before I close, is I believe that if there is anyone suffering from this, then it's worth researching. I think that there should be more of an effort to research this condition, because I can really imagine that it would be kind of scary to have this happen. So I believe that in the future there needs to be more research, and if I ever have to do like a research project in the future, I might consider researching this a little bit more and see if there are any other cases over the last 100 years that haven't really been documented, and see if there's anything that could help, because I believe that if even one person is suffering from an ailment, then it is worth looking into and trying to find a fix for it. Because just because it is rare doesn't mean that it doesn't matter. And another word on the misdiagnosis, there could also be the chance that there's a lot of people in the world that have just experienced this but haven't actually gone to a doctor or anything about it. Or they could have possibly been misdiagnosed into something else. So it could go both ways. Some ways meaning the misdiagnosis make there be less cases of alien hand syndrome, but it could also go the other way and mean that there are people who got misdiagnosed whenever they should have been diagnosed with alien hand syndrome. So in short, there just really needs to be more research here, but it is something that I found incredibly fascinating, something that I had never heard of, something that was kind of strange to wrap my mind around, because I really can't imagine if my hand just started doing things, or my leg, whatever, just started doing things on its own. That would just be really terrifying to me, something that I really wouldn't want to experience. And here are my works cited, and that's it. Thank you for watching.